Greetings, everybody, and welcome to the Public Health PBRN program webinar on sustainability. We're a couple minutes early, so we'll give folks a few more minutes to get dialed in before we get started. Greetings, everyone, and again, welcome to the Public Health PBRN webinar. We'll get started in just a few minutes, or just another minute or so to give folks time to dial in. Okay, well, again, thanks to everybody for dialing in today. This is the Public Health PBRN quarterly webinar, and today I think we have a topic that is of considerable interest to our kind of full cadre of stakeholders involved in the Public Health PBRN program, and that is this issue of sustainability and strategies that we're learning about within the Public Health PBRN program for sustaining practice-based research networks over time. This is a topic that was really nominated by a number of our networks over the last couple of months as we have thought about topics that we could address helpful to networks at various stages of development. It's a topic that we've touched base on periodically over time in this program, but we thought this is a good time to revisit the issues as we now have a larger group of networks participating in the program, including a growing number of affiliate networks. And as the landscape for health research in general and public health research in particular continues to change and evolve with new opportunities as well as new challenges, it's a good time to have this conversation and to think about strategies for sustainability. Obviously, if we just look at the PBRN program, we have networks that have come into this program over time. We've got our earliest cohort of networks that have been up and running for more than 3 years now. And then we also have affiliate networks that have joined the program very, very recently and are at much earlier stages of development. Some of our more mature networks have cycled through a number of different funding sources and funding cycles already within the program, as well as networks that are already experiencing success with attracting other sources of support outside of the Public Health PBRN program and even outside of the Robert Wood Johnson Foundation. Sources of support for for implementing research projects and sustaining their networks. So we certainly want to capitalize on that diversity of perspectives today, and to help people be thinking more specifically about strategies for sustainability in that sphere. The timing also is for this particular webinar is good in that we are all making plans to gather together in person in a few weeks as part of our annual grantee meeting that will be held in conjunction with the Keeneland Conference. And so that our upcoming grantee meeting will provide us with with an additional opportunity to drill down on some of these growth and sustainability strategies. But we thought doing a webinar now would help us kind of jumpstart our thinking and perhaps help us make even better use of our time, limited time that we have together in person when we're together next month. So all of that is kind of the rationale for doing this webinar. I'm hoping we can do today. Certainly, we've prepared some slides to talk through and to give certainly our thoughts from the coordinating center, our thoughts about strategies that are worth considering and worth exploring. But you all in the PBRN networks we recognize also have accumulated some very valuable perspectives. Have tested a number of different strategies, are testing a number of different strategies for growing and sustaining your network. So we definitely want to hear from you and hear your perspectives today as we go along. So I would like to keep this session as interactive as possible. We do have a pretty large group of attendees here. We've got about 30 people or so with us on the webinar and on the voice line. But I'd like for us to try to keep this as interactive and conversational as we can. So as we move along, you don't need to wait for me to prompt, for questions. As we move along, if you have insights to share or a question or comment to make, please don't hesitate to do that. It might be easiest if you use the chat feature if you're on the WebEx account. And can view the slides, and if you can see the chat feature or the chat box on your screen. As you have a comment or a question to raise as we move along, if you want to just briefly indicate that in the chat box, then I will monitor that, and I can make sure to give you the floor to voice your comment. If you're not on the web, if you're just on the phone, or if your chat box is not working, or if for whatever reason, you're welcome to as well. Just vocalize your question or comment, and we'll make room for you to do that. But I would like us to have to be as interactive as possible as we can, because a lot of the expertise and obviously a lot of the experiences around growth and sustainability, you all who are working in the public health PBRNs have are accumulating a lot of that experience that we want to tap and build upon today. So I'll also mention that in the lead up to today's webinar, we sent out via email a little 2-page handout, a summary of strategies that we'll kind of be using as a guide as we move along today's session. That was a document we developed probably a year and a half ago or so now, after one of our monthly Public Health PBRN conference calls where we had devoted some time to this topic. I think at that point our round 1 networks were kind of nearing the end of their initial PBRN grant and starting to think about this issue, and so that handout was prepared then, but we sent that around as well. We'll make sure that handout is also up on the website to the extent that it's helpful. That we'll be talking, kind of using that as a guide in talking through issues.
Crazy. Y'all have a good lunch?
Is there a comment?
More.
Maybe one of the other suggestion, if people, because we do have a pretty large number of people on the call today, if people could mute your lines while when you don't want to say something to the group, that would help us just with cutting down on the background noise and whatnot. And then again, if you want to make a question or comment, just indicate that to us in the chat box, or you're welcome to just open your, unmute your phone line and go ahead and vocalize at that point, and we'll call on you. You don't need to wait, till the end here. Please jump in as we move along with any questions or comments that you might have. And so for today's agenda, this kind of outlines some of the major kind of categories of strategies that we'd like to talk through today. And again, this tracks pretty closely with the handout that we sent in advance of this meeting. But we recognize that these are some ways some pathways for for tapping new and expanded resources and for growing your PBRN's portfolio of research projects. But this certainly is not the universe of strategies that are out there, and even a full assessment of the strategies that are currently in use within the PBRNs. And so, again, as we move along, please feel free to suggest other strategies and discuss other strategies that you all may be contemplating or testing within your networks. Starting with the discussion around funding and funding sources. This is obviously fundamental to the concept of sustainability of any new endeavor like the Public Health PBRNs. This program was started with funding provided by the Robert Wood Johnson Foundation, and many of all 12 of our primary public health PBRN networks, the networks that we call primary because they entered the program with initial support from the foundation. All of our primary networks received an initial grant of support, a 2-year grant to support network building and development activities and to support implementation of a small-scale research project of some type to give networks a proof of concept experience. But all of our networks, have had to consider strategies for tapping other sources of funding to continue their networks and to continue to grow their portfolio of research projects. And that's very much by design. Like a lot of the initiatives that are funded by the Robert Wood Johnson Foundation, and Foundation is interested in providing support to start programs and new initiatives and get them off the ground, but they are they certainly have expectations that the grantees they fund will use their experience base and use what they learn to look to other sources of support and to look to more long-term sustainability strategies, and that's kind of baked into the funding model that is used, certainly used in the PBRN program, but also used in many other initiatives of the foundation. And so as our networks grow and develop over time, there's a need, obviously, to look for new funding sources. Particularly funding sources as networks become interested in supporting more large-scale research projects. That's a particularly important reason for seeking other sources of support. A lot of the grants that the foundation has provided to our public health PBRN programs are in many ways relatively small scale, or certainly are contained in both financial resources and also contained or bounded in terms of time frames. And so as networks again want to pursue longer term studies, longitudinal studies, and larger scale studies, to produce a larger volume or a more larger volume of evidence or support a more rigorous research design. You've got to look to other sources of research support for those kind of studies. And then just also from a kind of a practical standpoint, it's certainly always best if you're looking for the kind of for the long-term impact of your program. It's never good to be relying on a single source of support for an enterprise, and it's always good to have a diverse portfolio of funding, to have a mix of shorter-term and longer-term funding sources that are overlapping in their startup and end dates, so that you can maintain a larger network over a longer period of time. And it is true that if we think about kind of the current environment for supporting studies of public health services and systems, that these funding opportunities are continue to evolve over time. In many ways, we've seen a pretty significant growth in at least potential funding opportunities for studies in the area of public health services and systems research. And so PBRN, public health PBRNs in particular, are well positioned to tap those new funding opportunities and use them to grow their base of support for networks. So thinking about how to diversify your research funding base is a kind of fundamental, I think, to thinking about how best to come up with a sustainability plan for public health PBRNs. As I mentioned, as we've talked about periodically in our conversations within the Public Health PBRN program, there are a variety of potential sources of support for funding research studies in the area of public health services and systems research. In general, the largest source of support for studies of this nature, just like the largest source of support for any kind of research endeavor in the health and health sciences arena, is certainly the federal government. And so all of our public health PBRNs, I think, need to be thinking about and positioning for success at some point with tapping federal research funding opportunities, just because that's that's where the money is in many ways in the health research environment writ large. However, I think because of the niche that public health, the research niche that public health PBRNs pursue, there perhaps is a broader continuum of relevant funding agencies to support PHSSR and to support research within public health PBRNs than perhaps there is for other more narrowly defined research enterprises. Because what we do in public health is so broad and touches so many different scientific and professional disciplines. The funding sources attached to those different disciplines and those different intervention strategies, those different health risks, are quite broad. And so PBRNs I think are pretty advantageously positioned to think about tapping a pretty wide continuum of funding sources. Just within the federal government, if we think about HHS funding sources, obviously the big gorilla in the HHS funding environment is the National Institutes of Health. They've got an annual research budget of over $30 billion now, which dwarfs the health research budgets of any of the other HHS agencies. And so certainly I think all of us who work in a health-related research environment need to be attuned to funding opportunities that are available from NIH just because of the magnitude of research that they fund. But also because I think the kind of work they're funding increasingly is relevant to the kind of studies that we're trying to do in public health systems and services research. So we can talk more specifically here in a minute about some of the funding opportunities that are now available through NIH that have current or potential relevance to PHSSR and the public health PBRNs, but certainly NIH is a major player. Some of these other agencies that you see listed here are smaller or some of them newer funding agencies within the HHS family, but that also have funding priorities that are in alignment with work that's happening in the PHSSR field and the public health PBRN field. ARC, the Agency for Healthcare Research and Quality, is predominantly their research focus is on studies of delivery issues that are more of a clinical nature, funding health services research, looking at medical care delivery and financing predominantly, and so that limits that limits how their relevance to what we're doing in public health and PHSSR. On the other hand, they have a very active research portfolio in prevention and care management, largely focused on the delivery and financing issues around clinical preventive services. But still, that's an area and a potential point of connection to the work that we're doing in PHSSR, and certainly, and so to the extent that your network is pursuing research that touches on issues of clinical preventive services delivery, or that touches on issues of how the public health system interfaces with the healthcare system in in addressing health needs or delivering prevention and health services, those kind of public health healthcare intersection issues are certainly of interest to ARC, especially right now in the context of health reform. So some of ARC's funding sources can be quite relevant. CDC has been a long-term funder of applied public health research through a number of different vehicles at CDC. Their resources more recently have been a bit constrained, with the federal budget pressures. But on the other hand, the Affordable Care Act of 2010 authorized a new federal program of research dedicated to public health systems and services research, and really tasked CDC and the CDC director with developing and implementing that new program of research, and so that creates an opportunity for perhaps enhanced CDC funding for this kind of research down the road. HRSA also, research is more of a limited. It's just a small piece of what HRSA does. HRSA, like CDC, is primarily a service agency, but they do maintain a number of different research programs and research funding opportunities that have relevance to PHSSR and to public health studies. Most notably, they have an active Office of Rural Health Policy and an active rural health research agenda. That includes an interest in studying rural public health delivery. And in fact, they funded some very good studies looking at rural public health delivery, in part through their network of rural health research centers that are supported with HRSA. HRSA also has a very active research agenda in maternal and child health service delivery and in pediatric research, which again also has relevance to services and delivery system issues in the public health arena. So they're they're an important source. And of course, HRSA's work in the health workforce arena also has some relevance to what we're doing in public health and PBRNs. These last two on that HHS line, last two agencies are somewhat of newcomers to the world of kind of applied health research, and I put those on here mostly because of the potential for these agencies to become future funding sources for public health PBRNs and for PHSSR studies. Corey, we've mentioned them a bit over time in our conversations within the Public Health PBRN program. They're a new research entity that was created under the Federal Affordable Care Act back in 2010, and they're still at the stage getting up and running. They're really still in the first year of implementation. The Corey is actually a quasi-governmental entity. They're technically a not-for-profit institute that receives funding to conduct applied research in patient-centered outcomes research and in comparative effectiveness research. And so if you look at their charge, it is largely focused on more issues that are more relevant to clinical service delivery and to patient care issues. But their mission is also defined to include studies looking at delivery system issues and studies looking at the delivery of preventive services and interventions, as well as therapeutic services and interventions. And so, I think there certainly is the door is at least partially open in terms of Corey funding for attracting interest and support for studies that looking at public health delivery system issues. Similarly, at CMS, the Federal Center for Medicare and Medicaid Services, there's a new entity created by the Affordable Care Act called CMMI, the Center for Medicare and Medicaid Innovation, which is overseeing a lot of the demonstration programs and evaluation efforts that are designed to test new delivery system models and new payment system models within the health and healthcare system. CMMI as well is more heavily focused on looking at issues of clinical service delivery and financing and looking at patient care issues. But they also have an articulated interest in looking at population health as one of the aims of health care and health system reform. And they are interested in as part of their portfolio of research looking at new delivery system models. They're interested in understanding the effects of these new delivery systems on population health outcomes and population health strategies. And they're certainly interested in delivery system models that include new roles for public health agencies and public health organizations to play within new healthcare delivery system strategies. So the CMMI activities, I think, are also an important potential source of funding for the work that we're doing. So all of that is just looking at the funding sources within the Department of Health and Human Services and within its research purview. Again, I think the beauty of the work that we do in public health services and systems research and the work that you all are doing in the public health PBRNs is that it potentially has relevance to a much broader array of actors and stakeholders and funders beyond just the funders that are embedded there in HHS. And I've listed just a few of the other, other federal agencies, executive branch agencies that have extramural research programs, funding programs that potentially, can be used to support applied public health research projects. The big one is obviously NSF, the National Science Foundation, which funds studies in a large number of areas. They fund they're perhaps best known for their studies in the basic sciences and mathematical sciences, but they also fund a lot of research in the social and behavioral and economic sciences. And they fund a lot of applied research as well, not just basic, but applied research. They fund a lot of research programs that involve collaboration between academic institutions and real-world industries or real applied organizations. They also fund a lot of programs that are involved in supporting educational initiatives to enhance the nation's scientific infrastructure. And so, again, I think NSF can be, potentially a very relevant funding source for public health PBRNs because of this academic practice model, because of the heavy use of kind of social and behavioral and economic sciences and some of the work that's being done within the PBRNs, et cetera. The USDA obviously is a major federal public health agency outside of the HHS framework. They fund research. They fund, obviously a lot of research in the nutrition area. I also listed the ERS here. That's the Economic Research Service within USDA. That's the one entity that I have some experience in working with. As they fund, again, economic studies looking at again, nutrition and food supply and food and environment kinds of issues that I know some of our public health PBRNs are interested in or have studies in. DHS is Homeland Security, which is an important funder of preparedness-related research. Department of Justice has a number of different extramural research programs associated with it. One of them is funded through the National Institute of Justice, which funds a lot of legal research, some of which certainly could be relevant to work that is being done around looking at public health laws and regulations and how they're playing out. HUD has several major research programs, including a major research program looking at housing policy and frequently has funded research looking at housing and health connections. So that potentially could be a relevant source of support. The Department of Education funds a lot of research, obviously, especially in looking at interventions in primary and secondary schools, and that potentially could be relevant to the public health strategies that are being used that involve collaboration with schools and educational stakeholders. EPA obviously is a major funder of environmental research and environmental health research. Transportation funds transportation research, obviously, and but not, including studies looking at pedestrian and bicycle facilities, and looking at active commuting strategies, et cetera, that begin to bleed into the work that we're trying that is going on in public health on built environment kinds of issues. I think it's important as public health PBRNs are thinking about, again, the range of different funding sources that potentially could be relevant to work that your network has going now or work that your network wants to develop. It's important to think about this full continuum. It's not just about the HHS agencies in particular. There are lots of other agencies around, just looking at the federal government, that fund work that intersects with public health issues and potentially could be relevant to your work. Let me stop there before we go into some of these non-federal or some of these alternative funding options, and see if there are questions or comments. And I see Nancy Young is posting a question here. And let me invite you, Nancy, to go ahead and articulate your question.
Well, I didn't expect to be called out, but that's fine. I was just wondering, I know that the National Center has done some work along these lines already, but this is an impressive list, and knowing sometimes that high-level discussions help to kind of grease the skids to these organizations being more receptive. Does the National Center intend to maybe have some proactive discussions, additional proactive discussions with some of these federal agencies, so that they might be more receptive to PHSSR projects and their calls in the future?
That's a great question, Nancy, and thank you so much for asking that. Certainly, that is an important part of our mission, the mission of the National Coordinating Center for the PBRN program, but also the other national center that's here at Kentucky, the National Coordinating Center for PHSSR. Both of these centers have, as part of our mission, growing the funding base for PHSSR, and that involves absolutely interfacing with these other funders, these other stakeholders, to make them aware of PHSSR and how PHSSR can be relevant to their research agendas, and to help tee up opportunities for PHSSR researchers within these funding sources. So we're certainly engaging those activities. Most specifically, we've had really an ongoing series of conversations with CDC, actually for a couple of years now, and helping them think about how to position CDC research funding to support PHSSR. We did some work last year with the Prevention Research Centers program within CDC, and there's still a lot of interest in the PRC program in forging research collaborations with our public health PBRNs. So we're continuing to work on that opportunity. That's been somewhat blunted, at least in the short term, because of CDC's own kind of funding cutbacks and cutbacks within the PRC program. But we continue to cultivate that relationship. We're also working very closely now with NIH, and in particular with the Office of Behavioral and Social Science Research, OBSSR, within NIH to tee up opportunities. Bob Kaplan, who's the director of OBSSR, is actually the chair of the National Advisory Committee for our National Coordinating Center for PHSSR, and so he's very much a kindred spirit and very much a supporter of PHSSR, and has been very helpful in helping us think through how to engage NIH in this enterprise, as well as helping us think through how to engage his counterparts in some other important agencies like the National Science Foundation and elsewhere to tee up these kind of opportunities. We've also been working very explicitly with the Clinical and Translational Science Award program within NIH to cultivate some specific opportunities for PHSSR support within the CTSAs. We can talk more about that today if you'd like. I think a number of you are familiar with CTSAs. A number of our PBRNs have academic partners who have a CTSA award, which is a great thing to have. It's a rare research infrastructure award that goes to health sciences, academic health sciences centers to support translational research. And PHSSR certainly is an important form of translational research, and the work that public health PBRNs are doing fit very well into this paradigm of translational research. So we're continuing to work with the CTSA program with Bob's help, as well as with some help of other colleagues and leaders within the CTSA program, to tee up some additional opportunities for PHSSR within the CTSA award and within the new National Center for Advancing Translational Science, the newest center within NIH that was created earlier this year to support translational research. So Nancy, those are just a couple of examples of kind of work that we have underway to start to kind of cultivate and condition some of these federal funders to see the value of supporting PHSSR within their research portfolios, and we're certainly going to continue to have to work on that front.
Well, thank you very much.
Thank you for that question. Any other questions or comments at this stage? Well, since we're talking about NIH, let me skip ahead. I think I've got a slide here more specifically on NIH funding priorities. These are, NIH is obviously a big enterprise. It's, I think their budget this year is almost $31 billion, and 80% of that goes into extramural research. 80% of that $31 billion is sent out the door of NIH to support largely investigator-initiated research, happening around the country and around the world in the health arena. Now we know that historically the vast majority of those NIH dollars have gone to support basic biomedical research, and the next largest share has gone to support kind of what we might call clinical therapeutic research, research designed to produce new knowledge about therapeutics, medical care treatment strategies, as opposed to research looking at more the prevention and health protection side of the continuum, activities that are more in the public health services and systems research arena. Nevertheless, I think NIH has made considerable progress in both recognizing the value of investing in more upstream research and looking at prevention in public health, and also investing in more translational research that helping us learn how best to deliver the strategies that are effective in preventing disease and injury and promoting health. And so some of these initiatives that you see on this slide are, I think, representative of some of the relatively newer NIH funding priorities that fit particularly well with public health services and systems research, looking at more upstream kinds of public health strategies, looking at issues that are more around implementation and delivery system issues, how to actually deliver public health protections, not necessarily discovering new vaccines or new behavioral interventions, but figuring out how to deliver those things that work in the real world of public health. There's the system science and health priority area that we've been trying to feature regularly in the newsletter and in terms of funding opportunities and training opportunities in this area that NIH is pursuing. And I think this is especially a good vehicle. The system science and health funding priorities is especially well suited to the work happening in public health PBRNs because, again, our public health delivery systems are certainly complex and dynamic and adaptable delivery systems. They involve, federal, state, and local partners. They involve, governmental and non-governmental organizations that are involved in the delivery of public health services. Many of you in your PBRN research projects are investigating different aspects of that complex delivery system in terms of looking at partnerships and collaboration, or looking at state versus local kinds of issues in terms of coordination and communication, or looking at new ways of organizing delivery systems, in terms of multi-jurisdictional models of delivery, or looking at cross-jurisdictional models of service delivery sharing. All those issues I think fit in this, in this domain of using system science techniques to understand the delivery of public health services and the intervention at a system level to promote and protect the public's health. Similarly, there's a funding priority area that NIH has supported for I think at least 6 or 7 years now, devoted to dissemination and implementation science. And there's an annual meeting that just wrapped up in Washington or in Bethesda this week, sponsored by NIH, that showcases the research that they're funding in the D&I dissemination and implementation science arena. And they're very interested in looking at dissemination and implementation issues in the public health arena. So, not just looking at medical care dissemination and implementation issues, but looking at these in the context of public health systems. And so that's another very, I think, exciting opportunity. We actually put together a research panel at last year's NIH D&I conference that showcased some of the research that I think 4 of our PBRNs presented at that conference last year. I know Colorado and North Carolina, and there were 2 others, and I'm sorry I'm blanking on the 2 other networks that were part of that session, but but I thought it was very well received. It was a a standing room only audience basically, or it was a full room of people who were very interested in hearing about public health PBRNs and hearing about, at that stage, some research that was still very early on in its implementation that was occurring through a couple of our networks and their research implementation awards. And so that's a funding opportunity. I think it's very relevant to work happening within the PBRNs. And in some of these other areas, there's a health disparities thrust. There's a new National Center for Minority Health and Health Disparities within NIH that funds health disparities-oriented research. Very relevant to, obviously to work that's happening within the PBRNs. Health literacy, research translation, et cetera. So some of these NIH funding priorities are actually quite relevant to work that's happening within the public health PBRN world. There's also, some of you who are quite familiar with the NIH world know that the NIH research tends to be quite disease specific. I mean, NIH is organized around a series of institutes and centers that are largely focused on specific body parts, if you will, specific disease areas or specific types of health risks. And so often, figuring out how to position your research to fit within the NIH model involves having to frame your research around one of these, disease areas or risk areas that, that are part of the NIH funding portfolio. And that certainly is the case. But there's also this last bullet here, the NIH Common Fund, that has been created relatively recently to fund research on cross-cutting health issues that don't necessarily fit within a single center or institute at NIH, don't necessarily fit within a single body part or a single disease process paradigm. And so I also think that some of the research opportunities available from the NIH Common Fund are, again, especially well tuned to research happening through the public health PBRNs. NIH likes to fund what they consider to be quote-unquote high-risk studies through the Common Fund. So studies that are very novel, that are proposing to do new things, that don't have a lot of support yet in the research literature. And again, that can work to our benefit, in the public health PBRN world, because we are kind of a new enterprise, and we're testing out lots of new strategies here. The Common Fund has also been tapped recently to support research looking at things that can inform implementation of health reform under the Affordable Care Act. And again, I think the PBRNs are especially well positioned for at least looking at the public health components of health reform and how public health agencies are adapting and responding and positioning for new roles under health reform. So the Common Fund is a nice resource for studies that are kind of non-categorical, that are non-disease specific or non-risk pathway specific, that can be quite good. So let me pause here. I see that Laura Hitchcock from our Washington Network has posted a question, I think back on our discussion about CDC funding. Laura, do you want to articulate your question?
Sure, yeah. My question was, I'm not tracking the appropriations mechanism. I'm just curious as to whether there really is a likelihood of there being funding appropriated for PHSSR, and maybe a little bit more, to learn a little bit more about the center that was set up under the Affordable Care Act at CDC.
Yeah, great question. So yeah, Laura's question was what's the status of the CDC authorization, the money that was authorized for CDC to create this new federal program of research in PHSSR, and what happened? What happened to it, and what's the likelihood of that funding actually being able to, manifest in the future? That's a great question, and as many as obviously, the Affordable Care Act writ large still has a lot of political uncertainty around it right now as the Supreme Court goes into a session, to look at the constitutionality of the provisions of the Act, but also the Public Health and Prevention Fund that was part of the Affordable Care Act that really houses most of the public health provisions has also continued to be a political hot potato. There remains a lot of uncertainties about the value of, devoting federal resources to that Public Health and Prevention Fund, and what was originally authorized to be $15 billion in federal funding for that Public Health and Prevention Fund. As we had talked about earlier last month, that Congress shaved 25% off of that funding allocation, and in part used that, steered away about between $5 and $6 billion of that support to help fix the Medicare physician payment problem, the sustainable growth rate problem. So there still is a lot of uncertainty about the funding for public health in general under the Affordable Care Act, and as well the funding for PHSSR that was authorized. That being said, CDC did receive a small appropriation last year under that authorization, and largely I think used it for purposes that I think were not real satisfying for a lot of us in the PHSSR world. It wasn't really used to create a new program in PHSSR. Part of it was used to sustain the CDC's Preparedness Research Centers program in the face of some major scheduled budget cuts, and that might be considered reasonable because the Preparedness Research Centers are certainly doing PHSSR in the preparedness domain. Some of the other funding was steered in to help sustain the Prevention Research Center program. But we didn't see a lot of real new money for PHSSR in that environment. I think there still is some optimism for seeing some new CDC funding for PHSR in this next budget cycle. They are authorized. I mean, it is a mandatory provision within the Affordable Care Act, so it's more secure from that standpoint. And my understanding is that there are plans underway for CDC to fund a larger set of PHSSR studies in this next budget cycle. But we'll obviously stay tuned to that. And that's something that we also, the Coordinating Center, continue to work with CDC on. We work very closely with Judy Monroe in the OSTILT office, which is kind of one of the kind of home bases for PHSSR at CDC. Obviously, they're a very strong supporter. Judy and her office was were very helpful in contributing to the development of this new national research agenda for PHSSR that will be, the final version will be unveiled at the Keeneland Conference here in a few weeks. And so I'm cautiously optimistic that we will see some new CDC funding down the road devoted to PHSSR. That's a great question, Laura. Thanks for that. Any other questions on that topic before we move ahead? Well, again, thinking about NIH, one of the other challenges with NIH funding is how darn competitive these research funding opportunities are. This is a slide I just pulled off the NIH website a few days ago, just the latest numbers on success rates of grant applications in at NIH. A couple things to note here. First of all, yes, it is very competitive. You look at the bottom line. These are just extramural research grants. These don't include any of NIH's training grants or career development award grants. These are just the R series, the R01s and R03s, et cetera. Overall, about a 17% success rate, right? So, they're competitive, and the success rate is much lower the first time out. As many of us who work in the NIH funding world know, that it often takes multiple submissions, multiple rounds of submitting a proposal, getting it scored, getting the feedback from study sections and then revising your proposal, your application in response to that feedback. It takes multiple iterations oftentimes to to get a score in the fundable level, and so it can take time. And you really, in a statistical sense, you shouldn't expect to get funded on your first submission at NIH. But the other thing you can see here is there's also a lot of variation across the centers here in terms of their funding success rates. I didn't put all the centers here. I just put the ones that are perhaps most closely related to public health and prevention kinds of studies. But as you can see, at NCI, the National Cancer Institute, which it has funded a lot of work in not a lot of work, but a non-trivial amount of research in public health delivery system kinds of issues related to cancer prevention and control. The success rate is under 14% now, versus some other centers. If we look at some of the other, if you look at the Minority Health and Health Disparities Center, they're down at below 12%, which is quite competitive here. So, but there is variation there. You see NIDDK, which funds a lot of the diabetes and obesity-related research, including prevention and public health-oriented studies. Because of the budget they have and because of the national interest in the obesity epidemic and finding solutions there, their funding portfolio is a bit larger than other institutes, and the success rate is a bit higher than some other institutes. So that's certainly something to keep in mind. I wanted to go back and quickly talk about a couple of other funding vehicles as well. What we've been talking about so far in talking about these federal funding sources are largely funding sources for investigator-initiated research. It's important to recognize as well there's also a parallel research funding enterprise that's funded by the federal government that funds what's kind of loosely labeled as contract research from many of the federal agencies. And the main difference between investigator-initiated research and contract research is, in this latter category of contract research, it's the federal agency that really kind of specifies the research needs and specifies the major parameters of the study that they're asking for. And then the applicants who apply for this funding have to, are basically developing a proposal that's in response to an identified research need and research topic identified by the agency. So there's less kind of, the investigator coming up with the idea. It's more the federal agency coming up with the idea and soliciting applications in response to that idea. That being said, this has been a growing component of the federal health research enterprise at the federal level. And a non-trivial amount of PHSSR studies are actually conducted through contract research funding mechanisms. It tends to be it's a somewhat of a different process of engaging in contract research. The funding opportunities that come out of contract research are they're publicly announced through the federal contract solicitation processes. Typically, the turnaround time, the response turnaround time, is much more rapid than a standard funding opportunity announcement that comes out of NIH or CDC. Often there's a 30-day response time or even shorter response times for applying for contract research. The other issue to be aware of is that for some of the contract research funding from the federal health agencies, those dollars are put out through what are called task order contracts, which basically are you apply as a research entity, as somebody who wants to do this research for the federal government. You would apply initially to be placed, to be selected to be one of the entities that's placed on a master contract task order list with one of these funding agencies. And then as specific research projects come up, they are put out by the agency as task orders, and they're just issued to the organizations that are listed on the master and a contract research list. And so it ended up being kind of a two-stage competition process. You initially have to write a proposal to be placed, to compete to be placed on the master task order list. And then once you're on that list, it's a limited competition to do specific studies that are funded through these task orders. And really all the major HHS agencies have these task order contracts. ARC does, CDC. CDC funds actually a lot of its true research through these master contracts, these task order contracts. HRSA has them, ARC has them. The ASPE, the Assistant Secretary for Planning and Evaluation within HHS, funds a lot of policy-oriented research through the ASPE task order contracts. So these can be actually, very good sources of support for doing PHSSR studies, and CDC in particular has funded a number of PHSSR studies through its task order contract mechanisms. But it's a little bit more of a hassle to get on, to be eligible for these funding opportunities. You've got to first apply to be on the master task order contract. Those are typically bid. The bidding process for those master contracts are done, on annually or on a 2-year cycle. But they can be, an important source of support, especially in the current, federal budgetary environment where some of these other agencies are seeing cuts to their extramural research budgets. That's making them, agencies, especially like CDC, more reliant on their contract research budget vehicles. And so, but that's something to be aware of, and potentially of interest. So that's federal sources. There are obviously state sources and then a number of private sources to be aware of and to think about thinking about funding for PHSSR and funding for public health PBRNs. A number of public health PBRNs already are tapping into some state resources for supporting their applied research and evaluation activities that are being conducted by PBRNs. Some of those studies are actually funded by the states because of federal requirements for evaluations that are attached to funding streams that state health agencies receive. That the Medicaid funding requirements in particular are perhaps the best known funding vehicles that have these requirements for evaluations. Anytime a state applies for a Medicaid demonstration project or for a Medicaid waiver program, there's a requirement. The feds require them to do an evaluation of their demonstration program or waiver program, and that can be a source of support potentially for applied research, especially a number of states now are looking at ways of modifying their Medicaid programs to better integrate prevention and public health strategies. In some cases, like Massachusetts, I think I believe just was granted a waiver that's going to allow the state Medicaid program in Massachusetts to start reimbursing public health agencies for specific non-clinical public health services that local health departments are doing in the area of environmental health, especially kind of housing remediation work to reduce triggers for asthma. And so that's an example of the state being creative and finding ways of drawing down Medicaid dollars to fund some public health programs. But that also then, because it's being done under a waiver authority, there's a requirement for the state to fund an evaluation of that program. And that'd be a nice thing potentially for the public health PBRN to actually conduct that study, to look at the effects of this new Medicaid reimbursed program that involves collaboration with local health departments to do remediation of asthma triggers. And there are other programs like that have evaluation requirements. A lot of the CDC grants that go to states have evaluation requirements. The cardiovascular disease or diabetes or tobacco programs that all have those requirements. And there may be ways of for the public health PBRNs to be involved in implementing, some of the evaluation components of grants that grant-funded programs that are operated by states. And again, I know that several PBRNs are already doing that. I think, again, the Massachusetts PBRN, if I'm not mistaken, Justine, is doing some work, evaluation analysis work under the state's NIFI grant from CDC, the National Public Health Improvement Initiative grant that Massachusetts received. And I think also in the past, the Washington PBRN has done some state-funded work related to preparedness and related to, I think, to the kind of pandemic influenza response, using some of the influenza funding that flowed to the state. So those those can also be very useful sources of support that are coming out of your state public health partners. In the non-governmental arena, there are also some important funding sources to keep in mind as well. Obviously, this program has been launched and financed heavily by the Robert Wood Johnson Foundation, and as the nation's largest health and healthcare philanthropy, they're obviously an important source of funding for the work that's done in public health and the work that's happening in public health research. They were one of the early agencies that initiated a funding program for health services research back 30 or more years ago, that helped to launch the health services research enterprise. And similarly, their funding has provided the basis for launching and growing the field of public health services and systems research. But there are a number of other foundations out there as well. Many of our public health PBRNs are located in states with that have conversion foundations in place, and that those foundations have a mission of spending charitable resources in for health and public health and community benefit purposes. And so those foundations potentially can be valuable sources of support for applied PHSSR studies. Even in states that don't have conversion foundations, some of the not-for-profit insurers, especially the Blue Cross Blue Shield insurers, have not-for-profit foundation arms that fund projects in the health and public health arena. So those certainly can be important sources of support, and it's good, certainly to understand the landscape of charitable foundations that have a public health mission within your state and region, and evaluating their prospects for funding some of the work that you're doing in public health PBRNs. There's also other, beyond the foundation and trail world, there are other sources of private sector support for potentially for the work that we do in public health. Perhaps one of the newer or more visible sources right now are not-for-profit hospitals, and the work that they fund through their community benefit requirements, their IRS requirements to devote resources to purposes that are considered to be of community benefit. That is, by virtue of their tax-exempt status by the IRS. This issue of hospital community benefit standards was revisited in the Affordable Care Act, and some modifications to the IRS standards for hospital community benefits were included in that Affordable Care Act, and that's part of the reason why we're seeing kind of a heightened attention now being devoted to this issue. And some of you, I know, I think are very aware of and engaged in this aspect of health reform. But a couple of things are important to note in that regard. First of all, hospitals now are required under the new IRS guidelines to do a community health assessment on a periodic basis. I think it's every 5 years, if I'm not mistaken. hospitals must do a community health assessment to identify health needs in their service areas. They must engage relevant stakeholders with public health expertise. They're directed, or at least strongly encouraged, to work with public health agencies in conducting that community health assessment. And then secondly, hospitals are required to show evidence of utilizing their community benefit dollars in ways that are consistent with with findings from the community health assessment. And so I think that those two standards potentially open up some very interesting and potentially incentivize some very interesting forms of collaboration between hospitals and public health agencies. And I think there are some important research opportunities that also may come out of these activities that public health PBRNs can tap. Certainly PBRNs could play, because of the analytic and evaluative expertise that you have together in your PBRNs. Potentially PBRNs could be mobilized to play a role in the conduct of community health assessments, especially as hospitals are looking at how to do this on potentially a regional or statewide basis, and how to do that in conjunction with relevant public health agencies. PBRNs potentially would provide a vehicle and a platform for helping hospitals to line up with relevant public health agencies and mobilize these assessment activities. But secondly, if you look at how the concept of community benefit is defined under the new IRS standards for this activity, appropriate uses for community benefit dollars include hospital investments in research activities. For the first time, this was not the case prior to the new IRS standards being developed under the Affordable Care Act. Prior to the standards being developed, the predominant kind of form of community benefit investment was hospital investment in charity care, in providing services at free or reduced cost to uninsured people, and also the cost that's borne by hospitals in delivering below-cost care financed by Medicare and Medicaid. Now, community benefit has been defined to include a much broad array of activities, including, direct hospital investments in research activities. And so, potentially, in some areas, you might find hospitals having an interest in investing in some research activities, to be conducted through public health PBRNs, especially if those research activities are likely to produce evidence that is locally meaningful and locally actionable, that perhaps could guide the activities of public health agencies and the activities of hospitals as they're thinking about how best to navigate and under these new community benefit requirements. And so, I think that's an important new resource, a new potential opportunity for engaging a non-traditional partner, perhaps, in the work that's happening within public health PBRN. The latest estimate I saw was that nationally, the aggregate value of hospital community benefit dollars in the not-for-profit tax-exempt hospital industry across the U.S. is somewhere in the order of $60 billion annually. That's the obligation that hospitals are obligated to show they're spending at least $60 billion in resources on community benefit activities. So that's twice the level of the NIH budget. That's a non-trivial amount of dollars. Now, certainly, hospitals aren't going to invest all that stuff in PHSSR, nor all of that work in public health activities. Certainly, a lot is going to continue to go into uncompensated care activities, especially until the health reform provisions kick in 2014 that should start to reduce some of that demand for hospital uncompensated care. But it's a big pot of resources that are out there that potentially there are some opportunities for working with that with those partners and to support work that's happening through your public health PBRN. Let me stop there because I know see if there are other questions or comments, because I know that there are some people in our PBRNs are already working in this area and may have some insight they want to share. Well, don't hesitate to chime in if folks have other thoughts there. So let me move us down. We spent a lot of time talking about research, funding opportunities and kind of expanding your the sources of support for research within the Public Health PBRN. So let's talk a little bit in our time remaining on some of the other strategies that I think are important in positioning PBRN networks for sustainability down the road. It's important not just to think about what funding sources are out there, but how best to position your network to compete for these funding sources, because all of us are, the research funding world is a competitive world, and you need to be thinking about how, what steps your network can be taking to make your network, as competitive as it can be for tapping these funding sources, whether they're RWJ funding sources or the many other funding sources we've talked about today. And part of this, competition strategy just goes back to making sure that you are producing a visible track record of the research and research translation successes that your network is experiencing as you're going forward. Certainly, if you're trying to compete for federal research funding sources, you're going to have to show a record, a publication record that shows, that demonstrates expertise in an area that you're applying for funding in, and it demonstrates a past record of actually being able to implement studies through your network. And so, our recommendation is, publish, publish, publish. Make sure that every project that you're conducting through your network, that you're taking advantage of that as an opportunity to publish something, ideally in a peer-reviewed vehicle, but also, taking advantage of the many non-peer-reviewed and professional publication vehicles, ways for establishing a paper trail of the research successes of your network. This allows you, again, to begin to kind of carve out a niche for your network to show that you've got a cluster of studies and a cluster of publications in a particular area that shows an area of research. Allows you to kind of stake out a niche for your network. But again, just these are we know there's limited signals of kind of productivity and capacity, but they're signals that are used very heavily, definitely by our federal funding agencies and by many other agencies as well, as a measure of success. And so, that's the currency that's one of the currencies that we we navigate with in the world of research, and it's important to recognize that and take advantage of it. So even your small-scale research projects, publish those. Even if you publish them as short research briefs, in AJPH or one of the other journals that allows you to publish just a small note from the field or a small preliminary research report or brief research report. It doesn't need to be a full-blown, glorious scientific research article. It can be a small piece in a professional journal or a practice-oriented journal, but publishing that, is very, very, very important. Publishing your small-scale research projects, any measurement developments. Many of you have developed new studies, new survey instruments, new ways of measuring important elements of public health practice, like the QI collaborative instrument that we heard Bill Livingood present last week. That's a new instrument, and they adapted it from a previous instrument. That they validated it. That can be a standalone publication right there, showing your network's ability to contribute methodologically to the field of PHSSR. Publishing your experiences with research translation and with using findings from your research to inform practice decisions, inform policy decisions. That can be very important as well. You don't just have to wait till you actually have a research result or a quote-unquote finding to publish a paper. You can publish instruments. You can publish, your experiences with actually, organizing your PBRN, your experiences with engaging practitioners in the process, and certainly publishing, your experience with research translation can be very, very valuable. It can help to show your network's expertise and its productivity. It's also important to think about establishing a record within your network of being able to move toward increasingly larger scale research projects. And in particular, how you can use some of the smaller research projects, kind of the early initial projects that your PBRN developed, how you can use those findings and those experiences to then compete for larger scale research projects from funding sources. Again, especially for federal funding agencies, if you apply for one of these larger scale grants from NIH or CDC or others, those funders are going to want to see, some evidence from preliminary work that you've already done that shows some proof of concept for your study, or that shows, that the feasibility of an intervention or a measurement technique that you're planning to use, or that shows there's a reason to pursue the larger study that you're proposing. So you can use findings from your smaller scale projects, from your early projects, from your quick strike research projects as the to flesh out the preliminary study section of your grant proposal for a larger award from one of these federal funding agencies. And that's in many ways, we like you to use especially the quick strike research funding mechanism for that purpose, to think about, if I do this small-scale, time-limited study, how is it going to help my network, perhaps then compete for a larger-scale award, a larger-scale follow-on study down the road. So that can be very, very important. It's very hard to compete for a large-scale study when you don't have any preliminary evidence that what you want to do is going to be feasible, or it's going to be effective, or it's going to actually address an important health need or public health issue within the community. So use your small-scale research projects to hammer that home, to provide that evidence on your grant application. And there are other sources of support for small-scale studies as well, ways that you can apply for pilot study funding from other funding sources. Even most of the federal funding agencies have pilot grant awards, have demonstration project awards like the R21s and the R03s that are specifically designed to fund smaller scale research projects in anticipation of those projects leading to larger projects down the road. And so it's always a good idea, rather than starting right out of the gate trying to apply for a big 5-year, multi-million-dollar R01 award from one of these agencies, maybe you can start with an R03 and R21, a smaller 1 or 2 year award, to implement as a beginning point toward moving to a larger scale project. But you want to have that in mind, thinking about kind of planning for a succession of increasingly larger research awards that can support increasingly larger studies through your network. Another strategy that we've talked about periodically over time is this notion of building the pipeline of research partners within your networks at multiple different stages of development. One of the bottlenecks that I think all networks face is the number of kind of qualified and skilled people who are engaged in your network, who are ready to develop and lead research projects. People on the research side of the house that might have people who have the expertise to be credible PIs on research projects, as well as people working in the practice environments within your networks who are have the skills, the leadership skills and the practice experience to lead these kind of projects. And I think ideally, as your network matures, you want to avoid being dependent on just one person, a single investigator, or just a very small number of people who can serve as PIs or project leaders or project developers within your network. Ideally, as you grow, you want to grow that cadre of people who are able to lead projects. So that's going to allow you over time to operate multiple research projects, in parallel, that might involve different components of your networks. that allows you to bring in both a mix of more senior people as well as more junior people to help you begin to build that pipeline of of people who can lead research projects within your networks. Potentially, this can allow you to start to even reach further back in the pipeline as well and involve graduate students and others who are in the training pipeline to become leaders and PhDs down the road. One of the advantages of involving more junior people and even students in your research is that those people may not already have, first of all, they tend to have more time available than your more senior established researchers and practice leaders, fewer commitments and more time available, but they also are more open to exploring research in a variety of different topics. They haven't already decided that I'm only interested in cancer prevention or I'm only interested in obesity-related work. And so they're more amenable, perhaps, and more adaptable to focusing their research activities on topics that might be, coming from other members of your network, topics that might be of special interest to practice partners, but you're having trouble finding somebody on the research side of the house who's willing to take it on. More junior faculty, junior, researchers and graduate students, often, in my experience, they're a little more adaptable, more willing to, they haven't already staked out an area of specialty, and they're more willing to, to take on a variety of topics and to merge their interests with those of other stakeholders in your network. So that's another reason to try to grow the mix of collaborators in your network in terms of kind of where people are at different career stages in the field. Any thoughts on that dynamic? I know that some of our networks have done this very explicitly. In fact, we heard from a webinar we did back in the fall that Ed Baker from the North Carolina network did with us. I think talked specifically about the strategies that he's been using in the North Carolina network to engage leaders in the academic side of the house, in particular at different kind of career stages to make this happen. But are there some other thoughts or experiences that folks have on this front? Another issue, and we talked a lot about kind of research funding opportunities earlier in this call, and I think it's also important to recognize there are many ways of funding projects outside of a traditional research grant or research opportunity, and often there are very useful opportunities for funding that come in the guise of evaluation components, or that can be built in, analytic activities that can be built into practice and service grants, again, that may be led by state or local public health agencies that are part of your networks. And so, I would advise to not overlook those opportunities as well. I mentioned the NIFI grant, the CDC NIFI grant that is going out to mostly the state health departments and a few of the large local health departments. A couple of our networks are receiving funding from the NIFI grants in partnership with our state agencies to do performance measurement and analytic activities in support of those NIFI grants. Applied public health research that's being funded off a service grant from the CDC. There are other kinds of opportunities like that. In the workforce training arena, the public health training centers that are funded by HRSA are explicitly designed not to be research centers. They're supposed to be training and workforce development centers. However, there are lots of ways in which applied research and evaluation and analysis can fit within, can inform, and be synergistic with the work of training programs, evaluation activities, needs assessment kinds of activities that can be built into, the work of training centers. And so, again, PBRNs can potentially play important roles in those kind of activities and tap those training grants and service grants as potential funding opportunities. And lastly, I know that we're running a little short on time. We've talked already in past venues about the potential advantages of coming together, of networks coming together and forming partnerships to support multi-site, multi-network research opportunities. And I think this is an especially important strategy for networks to think about, especially in competing for larger scale, multi-year kinds of research opportunities, especially from federal funding agencies. A lot of our PBRN networks are still relatively small in terms of the number of practice settings that are involved in your networks, and so that limits sample size, that limits power, that limits the diversity of practice settings that any one network might have at its disposal. But as you bring together multiple networks who come together and kind of agree to implement a standardized research program and collect data in a standardized way, and to build in collaborative measurement and analytic activities, this strategy kind of can enable you to undertake a much larger project, can enable you to engage a larger, more diverse, more representative collection of practice settings, and this can be a very productive way of competing for larger scale awards. This is the rationale behind the FAST study that Betty Beckmeyer has been leading. This is the rationale behind the IMPROVE study that we'll be launching here shortly with 6 of our networks. And I think we increasingly need to be looking at these kind of opportunities. In closing, I think the last thing I'll say is this: the other thing to remember is there are lots of potential partners out there to help you do this kind of work, and that potentially can help you grow your network and grow its sustainability. We've talked about a number of these other kind of kindred spirits in the research enterprise, that other kinds of research centers that are focused on translation research and practice-based research. Many that may be available and operating in your state or in your the same academic partner that you're working with for the PBRN program, that can present opportunities for collaboration. The prevention research centers, the primary care PBRNs and dental PBRNs and pharmacy PBRNs that are out there, the CTSA awards, the health disparities research centers, the rural health research centers at HRSA, et cetera. There are these are just a few of the kind of the organized centers that are up and running around the country that have a mission of applied health research and that are open to applied public health services and systems research. We will be planning at our grantee meeting some opportunities to discuss some of these kinds of collaboration in a little bit more detail, and so I hope that you'll bring your ideas and experiences with you to the grantee meeting and help us think through some of these partnership opportunities with a little more specificity and clarity. So I will stop there. Be glad to take any last-minute questions that we have for today, if there are any. And hearing none, I think we can go ahead and close out for today. And again, I hope you'll just remember, we hope to use this as a way to kind of kick off our discussions about sustainability and about opportunities for growth. Our grantee meeting in a couple of weeks at Keeneland will provide an opportunity for doing this in more detail. I think allowing you individually as networks to network with each other and to hear more specifically about the strategies that you are experiencing to date. So please continue to think about these issues and to bring your thoughts and your questions and your solutions to the grantee meeting as well. We'll look forward to continuing this discussion with you. And thank you all for being a part of this session today.
Thank you.